DPH Commissioner Monica Burrell has signed 2 public health orders that have been issued today. The first order relaxes administrative requirements so that physician assistants, or PAs, who previously worked on elective surgeries can now work on other healthcare demands, including COVID-19. The second order, due to the expected demands on nursing staff, allows pharmacists to administer certain medication for the treatment of opioid use disorder instead of requiring a nurse to do so. Today, we're also announcing measures for administrative tax relief for local small businesses impacted by COVID-19, especially in the restaurant and hospitality sectors. This process was designed in consultation with our partners in the legislature, and we want to thank them for that. For small businesses defined as those who paid less than $150,000 in 2019 sales and meals or room occupancy taxes, we will be postponing the payment of their respective sales, meals, or room occupancy taxes. Taxes due for March, April, and May will instead be due on June 20th. We will also waive all penalties and interest that would otherwise apply. The Department of Revenue is currently drafting emergency regulations to put this relief in place, and we expect them to be finalized before Friday, when the first payment would be due. Regarding unemployment insurance, I just signed emergency legislation to allow new claims to be paid more quickly by waiving the 1-week waiting period for unemployment benefits. The Lieutenant Governor and I would like to express our thanks to the legislature for turning this legislation around quickly. This important change will ensure that we can get much-needed unemployment assistance to workers who are impacted by COVID-19. Our administration is now ramping up operations to make sure that we can respond to the significant spike in unemployment claims. Our Labor Department is deploying additional employees to work on processing that large volume of claims, although, as we have said before, if people can apply online, that is preferred. We've also created a new COVID-19 workforce webpage that includes the latest guidance for employee qualifications and additional information. That can be viewed at mass.gov/unemployment/COVID-19. With respect to child care, effective March 23rd, all early education centers and family child care providers will be closed. As a result, we have issued emergency procedures to set forth a process for opening exempt emergency child care programs. This will provide priority access for families of emergency personnel, medical staff, and others critical to fighting the COVID-19 outbreak. Volunteers, teachers, and staff from some child care programs have already reached out to the department to say that they are ready and willing to continue providing care, which will be a relief to many of the parents who are working day and night to combat COVID-19. Families who work to maintain the health, safety, and welfare of all Commonwealth citizens will receive priority access to these emergency child care programs. Vulnerable children will also receive priority access. We'll work hard to make space for people who must go to work but aren't necessarily emergency personnel available as well. These emergency child care programs will be the only ones allowed to operate during this state of emergency, and EEC is working to ensure there is sufficient access to emergency child care programs in every region of the Commonwealth. Providers impacted by these closures will continue to receive child care subsidy payments from the state in order to ensure that the programs will be able to reopen once the crisis is over. Now, earlier today, I sent out an email to all executive branch employees to check in and to remind them that we are committed to getting the Commonwealth through this very difficult time. I want to share a little bit of what I wrote because I think much of it will resonate with people across our great state. The spread and effects of coronavirus has been sudden and stressful, but I believe the preparations, planning, and steps we're taking to mitigate the spread are the right things to do to deal with this public health crisis. I also recognize and appreciate that many of our decisions come with disruption, dismay, and disagreement. Change of this magnitude in such a short period of time is jarring under any scenario, and these changes come with financial and health risks on top of them. When people ask me why I've spent almost 20 years of my professional career either working or serving in a volunteer capacity in government, I always give them the same answer. Where else can you make something good happen for people or stop something bad from happening to people? That maxim has never been truer or more complicated to explain or understand. For the short term, our goal is to keep COVID-19 from spreading. That message gets interpreted in a variety of ways. Let's try this. 80% of the people who catch COVID-19 are going to feel like they have the flu. But it is very contagious. It is spread through droplets. It is not airborne. That's why we keep telling people to wash their hands regularly, use hand sanitizer, cough into their elbow, and maintain their distance. Now, for the other 20% of the people who catch COVID-19, it will be very serious. So the goal here is to limit the spread and the size of the spread so the disease itself doesn't overwhelm our healthcare system and hopefully reduce the number of people who are particularly at risk from getting it in the first place. We're going to do all we can to maintain social distance, wash our hands, do phone calls instead of meetings, and try to stay healthy. For me, that includes no longer visiting my 91-year-old dad in person, which I usually do almost every week. Stopping the spread, really separating the healthy among us from those who caught COVID-19 is the single most important thing we can do. Today, thousands of public servants settled into a new routine, many of whom are working from home. Many more, however, are stepping up to this plate to ensure that state government in all its forms will continue to operate. We're doing everything we can to keep them safe while they carry out essential functions for the Commonwealth. I want to thank them for stepping up. Unemployment claims are being processed. Trains, buses, and commuter rail are running. Utilities are operating, and rules that protect individuals and families from dislocation have been issued. Small business assistance is being put into place. Our emergency operations centers are up and running. Phones are being answered. Driver's licenses are being issued and renewed. Public safety officials are on the job, on our streets and in our neighborhoods. Service providers are being paid to care for those who need it most, and programs that feed and house the less fortunate among us are operating. Thousands of public servants are stepping up, and I know I speak for many of them when I say thank you for all that you do in the good times and the bad ones. There's much to do, but we're grateful for everybody's commitment to their fellow citizens. And we give everyone our word that we will devote everything we've got to defeating this.